So, I was talking about something that can be very confusing, and what we're talking about today is when hormones are normal, but pregnancy still doesn't happen. That is what we're talking about. When hormones are normal, but pregnancy still doesn't happen. You have done the tests, everything comes back just okay, within range, normal, no abnormalities. Yet, months and months and months have passed, even years passing without pregnancy. What? This can lead to a frustrating and misunderstanding. And people ask the question, if my hormones are normal, why am I not getting pregnant? Even me, I want to know. But again, understand, because this answer will come from, it actually lies in the critical concept, which is one of the reasons why I'm having this discussion tonight. The answer lies in the critical concept, and that concept is normal. What you call normal does not always mean that it is optimal for fertility. You see the difference? So forget about the grammar, just understand the gist, right? So what does normal really mean when you talk about medicine, when you talk about fertility? What does normal mean, right? So this is the gist. Laboratory tests interpreted using certain references, right? Of course, a lot of research has gone into these things, so we are not doing trial by error, but there are references on which those tests are done, right? Now, this range are based on average population that was tested, right? And maybe a broad definition of what health is. Is that okay? So when a hormone test is labeled normal, or whichever one on your result is labeled normal, what you're trying to say is that after testing you, it falls within the statistical range of average people, not necessarily meaning that is ideal for conception. You'll be amazed. Please come for the business week. I have something to unveil. Some of these things I'm saying now, by the time I unveil it, the whole world. So that's what it is. Even though value falls within what is expected among many people, or is it adequate? Is it optimum for fertility with respect to you, right? So now let's look at, I don't speak too much grammar. I've talked about normal and optimal. So the question now is, what's the difference? What's the difference, right? But remember one thing, that fertility requires precision. It's not trial by error. It's not the more try here, more try there. No, it is precision. Hormones must not just exist within the limits, right? They must rise at the right time. They must fall at the right time, because what happens to you as a normal human being is that these hormones in your body rise and fall to give you the normal feeling and normal function of your system that you have, right? It's not only reproduction that has hormones, but we are concentrating on reproduction, right? So these hormones must rise at the right time and must fall at the right time, interacting with themselves correctly, right? If this rise and fall does not happen, or the interaction does not happen, That's the beginning of the problem. Even if they are adequate, that is the beginning of the problem. For example, a progesterone level may be normal, right? But not high enough to support implantation. You were tested normal, but it is not high enough to support implantation after fertilization are taking place. What about estrogen? Remember we talked about estrogen yesterday. Estrogen levels may be normal, but it's not rising properly before ovulation, because it has to rise and signal the release of LH to trigger ovulation. If that does not happen, a lot will go wrong. Why? Because hormones work in timing, not just levels. Is that okay? So your test is checking levels, but beyond the level, which may be normal, it works with respect to timing. It has to rise and fall at the right time. And this is one of the most important concepts. It is. Hormones they are not static, not like you don't pump hormone, then it's there forever. Right? It's dynamic. There's a continuous shift, the continuous move, the continuous interaction going every day in your body. Remember, for example, like using men. For example, a man wake up in the morning full of energy. Why? Because testosterone. Full of energy, goes to his job, do everything he needs to do with gusto and strength. But as evening time comes, his energy begins to reduce. It's not because of hunger. If the egg can burst, I understand your question, Victoria, right? But as evening time comes, his energy is beginning to decrease. It's not because of hunger. Why? Because testosterone levels is going down. All right? So you can see hormones rise and fall. As testosterone level is going down, cortisol is going up. The rise and fall of hormone. Please ask me that question when I'm done, because I don't understand it. I need to hear it from your voice. Is that okay? So because they rise and fall, they are not static. They change throughout the day. They change throughout the day. They change across menstrual cycle, right? For those who have been with me for a very long time now, I've talked about the 28-day cycle of a woman. The cycle of a woman is like the cycle of the moon. That cycles around 28 days. I've done a very elaborate discussion on that. I hope one day I'll go back to that. But nonetheless, I said all that to say that because of this dynamic nature of hormones, right, a single test or blood test will be like you are taking a snapshot, momentary snapshot in a moving system, right? So you may not necessarily be getting the full picture, but it gives us an idea, right? It gives an idea. You know why this matters? Do you know why it matters? It matters because you can actually capture a normal value at the wrong time. It's possible. Then you are missing the actual problem. You see, for many years now, I've met people, we're trying to conceive, we've done everything looks okay, but yet pregnancy. That is the reason why we are here every night talking about this thing. To give you a clearer idea of what is going on. Because you are just stuck on your lab results, which is just a snapshot of the true picture. And many of them will say, doctor, just give me drugs that will solve the problem. No, you cannot have drugs. You may just be worsening the situation. Right? If you are still here, please talk to me in the comment section. Just type, I'm here. Right? So, let's go ahead and let's look at common situations where hormones are normal but fertility struggles. Maybe that's even your situation. They don't test you, chook you, pin, draw blood, do test. Hormones are normal, but you're still struggling with this fertility thing. What is going on? A lot of people have even attributed to diabolic means or even village people altogether. But let's look at the common situations. Please tap on your screen. Tap on your screen. Let's tap. It's very important we tap so that other people can come and learn. You don't know how people are struggling with infertility. And all it takes for you to get them here is to tap on your screen. Let them find us. Is that okay? If you are just joining, you're welcome. If you are not following me yet, you want to follow me. That will be one of the best investments you have made this year by following me. Is that Edo Finest? Edo Finest is here. So, I was going to talk about the common situations where hormones are normal but fertility struggles. Hormones are normal. Louise Catherine is here. Hormones are normal, but fertility still struggles. Common situations. Let's take the first one. The first one is that ovulation occurs, but is weak. Oh boy. Ovulation is happening, but it's weak. Right? Now, you have tested the hormonal levels, and the hormonal levels may even indicate ovulation had happened, or ovulation, you're ovulating. But the egg may not mature properly. Possible? Yes, it's possible. Yes, possible. Progesterone may be insufficient. Right? If you are just joining, welcome. Follow me, tap on your screen, share the live. So that is the first situation. The first situation is ovulation occurs, but is weak. And I just told you what weak means. Weak means the egg may not mature properly. Right? Progesterone may be insufficient. Right? So the second situation, there may be subtle hormonal imbalance. Subtle hormonal imbalance. In other words, it's not obvious, but it's there. Right? It's not obvious, but it's there. Meaning that small shifts in estrogen, for example, we talked about it yesterday. Small shift in estrogen, small shift in progesterone, small shift in LH or FSH may not cross abnormal threshold, but still it affects fertility. Can you what? Malabo. Can you drink? I don't understand. Ask the question again. Ask the question again. I don't understand it. Right? So small shifts in hormonal levels or even interaction can be problematic for you in your fertility journey. The third situation, Okay, it's a good question, Lewis. It's a good question. Let's deal with that in the Q&A session. When I'm done with this, we'll talk about it. Right? So the third situation is timing mismatch. Remember, reproductive biology is all about timing, precision, and biology. Right? It's all about timing. Hormone may rise, but sometimes they may rise too early or they rise too late. Of course, there are reasons why that can happen. But when they rise at the wrong time, there's going to be disruption of ovulation timing. There's going to be disruption of uterine readiness. Fertility is a time business. It's not when you like. And that is why you've got to prepare for it. Right? So you can have time mismatch. It's actually a situation that can happen. Now the fourth thing is there may be poor hormonal coordination, right? Remember what we talked about yesterday about estrogen? Because you see, fertility depends on hormones working together, right? Those that are rising will rise, those that are falling will fall at the right time. So they work together. So even if each hormone is normal individually, the sequence may be off. Right? When did this one rise? When did this one fall? Right? So just the simplest possible way to understand this thing. Right? And there are also conditions that can hide within what a normal hormone is. Right? Some conditions are hiding in this your normal hormonal test. Hiding. What are they? If you are here, talk to me. Just type tell me. Because I just ask you what conditions you could have where conditions that are hiding within a normal test. What are they? So just type tell me in the comment section. Then I know you're here. If you're just joining, you have not followed me, you want to follow me, especially if you are trying to conceive. Especially if you're trying to conceive. Alright. Okay, I didn't see Malabo's I didn't see what they commented. But it's good enough. We have people in the comment section to take care of it. Alright, so where was I? 29th April. Is that your name? But again, good to see you. You're welcome. So I said there are conditions that can hide inside this your normal hormones. Conditions like you could have mild PCOS, notorious PCOS. I'm going to talk about it next week. This notorious PCOS is all over the place. So we'll talk about it next week. So you can have mild PCOS. Hormones may appear normal, but ovulation is inconsistent in such cases, right? You will have endometriosis. In endometriosis, hormones may be normal, but inflammation would affect fertility. Can you see what's going on? Hello, sir. Is the background music from TikTok? No, it's not from TikTok. No, it's not from TikTok. It's from me. It's part of my playlist. All right, where was that? Right? Endometriosis. Right? Then thyroid variation. Right? The levels may fall within range, but the impact of these thyroid hormones can affect reproductive function. And I'm going to deal with that in details. Next week is packed with all these notorious cases. Remember, 2 days ago we talked about LFD, right? That is a luteal phase defect. Luteal phase defect, where you have progesterone present but not sufficient, right? So these are conditions that can hide within your normal tests. For those of you that are trying to conceive, if you're just joining, you're welcome. I see you. Tap on your screen, share the live. If you have a question, I will take your question if you have tapped at least 1K like, because it's important. All hands must be on deck. Let's help people. Imagine if everybody conceived today, the world will be a better place because everybody will be happy, right? But Bele no go 2 days for this world. So let's help other people that try to conceive find us so that we can teach them the right things to do. I will answer your question when it's time for question and answer. Is that okay? You're okay. Now remember, when we talk about hormones, it's not just women that have hormones or could have hormonal issues. There is the male side of normal hormones that can be a matter, right? Now this whole concept also applies to men. A man may have normal testosterone, right? A man may have normal testosterone. Maya is here. A man may have normal testosterone, normal hormonal profile, but still have poor sperm quality. And if you've not seen our videos on male infertility, 30 days, 30 episodes, go to YouTube, Dr. Godwin EMB. All right. Thank you very much, Stephen, for the heart, man. So go to YouTube. Everything you need to do as a man to produce precious sperm, I've taught it in 30 days. You don't want to miss it. If there is a man in this world today that is not producing precious sperm, it's because he has not watched my YouTube videos. Right? So copy the link, share it to them, let them know how to produce precious sperm. And by the way, tomorrow is Black Friday for knacking. So get your John Thomas ready. Then bring the result to us in June because we want everybody to be pregnant. So where was I? I was talking about in men, you're going to have normal hormones, normal testosterone levels, normal hormonal profile, but sperm quality is poor. Sperm quality is poor. DNA damage is there. There is reduced motility. The ability for sperm to move forward could be a problem, right? Why? Because hormones are just one part of male fertility. There are several other parts. So that's why you need to catch up on what we have said on YouTube. It will bless you. It will change your story, right? All men should produce precious sperm. If you are not producing precious sperm, go and watch the videos. You will. You will. And all it takes, you don't even need drugs. You don't need drugs. That's why a lot of people don't like me. So, you don't give drugs. I don't want to talk to you. So I'm asking you, is the drug helping you or is compounding your problem? Continue. Continue until you don't have any options. Right? All right. So I said all that to say the hormonal test is not enough. It's not enough because there are limitations when you do just a single test, right? There are limitations, right? Because male fertility rely on one-time blood tests. Yes or yes, right? But again, we know that hormones fluctuate. If it fluctuates, at what time are you doing the test? At the time of its rising or the time that it fell? So the test is a momentary snapshot, but not a full gist. That's why you can have normal tests and you still have some trouble, right? For example, progesterone changes throughout the luteal phase in women, right? For LH, it surges briefly. Yeah? Estrogen rise and fall. So at what point of these fluctuations are you testing? Because without proper timing, the result can be misleading. And you are on a confusion roller coaster, right? Right? So just understand what we are saying, because your laboratory tests may be normal is also different from what functional normal means. Functional normal means that hormones are working effectively, the timing is correct, the coordination is intact. That is part of what you should be looking for. Fertility depends on functional normality, not just one singular understanding, right? So these are the things that are rarely discussed. Right? The human body requires precision. Hello, Momo, I see you. Small hormonal shifts can have large reproductive effects. You'll be shocked. For example, the other day we were talking about ovulation. Stress can shift ovulation time, delay it, or even suspend it altogether. Stress. But there's so much information on that, so go and check it out on YouTube. I'm sure you're going to learn a lot. So if you want to find the channel, Dr. Godwin EMB is the name on YouTube. Whatever topic you're looking for, search it. You will find it there. Besides all that, not all fertility problems are hormonal. So you don't blame hormones for everything, right? Even with perfect hormones, what about, have you evaluated the sperm? There could be sperm issues. There could be tubal issues, like blocked tubes and stuff like that, or damaged tubes. There could be uterine factors, fibroid, right? Adenomyosis, endometriosis, all these kind of things. And all these can prevent pregnancy. So it's not just hormones. Hormones can be normal, but there are other things that are fighting against your fertility. Ade Love is here. So what should you do when your hormones are normal? What should be done? It's very simple. Open your eyes and understand. Thank you very much for the rose, Steven. Now the hormones are normal. Look beyond the hormone. Look beyond it. Right? Now go ahead and evaluate other things. We have been trying to conceive 1 year, 2 years, 5 years. Hormonal tests are normal. Look beyond it. Evaluate sperm quality. Right? Check out fallopian tubes if they are patent or blocked. What about the uterine environment? You look in those directions. Then when you're done with that aspect, also go ahead to assess timing. Is my timing right? Right? Is my timing right? Time of testing, right? Time of testing. Also evaluate function. Focus on ovulation quality and the luteal phase strength. If you don't know what I'm talking about, go to YouTube. I did that 2 days ago. And one thing people really take advantage of is advanced testing. When it's necessary, go for deeper investigation. And I tell you, it may reveal even the slightest of issues. But they get us, oh, money no day. I know, right? Don't worry. We'll start GoFundMe for people that are trying to conceive. So that we'll be able to solve some of these problems. Good evening, Kafi. Kafi is here. Hello, Kafi. Right? You see what we're talking about? Also have the emotional impact. If you have never attempted or struggled to have kids, you don't understand what I'm talking about. And I always say time and again, one thing that you don't want to happen to your worst enemy is infertility. You don't wish it on anybody, because it will not only drain you emotionally, it will drain you financially and physically. There is the emotional impact. Look at it. You are told that everything is normal. That is confusing. How can everything be normal and 5 years has gone? I'm still trying to conceive. You know what that does? It creates doubt. I didn't really tell you. This is the reason. Oh boy, I'll always remember. This is the reason why people go from place to place, from clinic to clinic, from one doctor to the other. They go from one spiritualist to the other. They go from river to mountains to forests, looking for solution. Why? Because everything is normal. Why am I still not pregnant? Begin to doubt yourself. And they spend a hell of money. Right? Doubt, frustration. Have you ever seen somebody? You've had somebody here one time in the comment section said, I'm tired. No, don't be tired. Don't be tired. And like I always say, don't pack your bags yet. Calm down. Let's talk to you. But it's not your fault. Good evening, Musa Auta. I see you. You're welcome. Good evening, Sunshine Baby. Good to see you. That sense of being stuck is the reason why somebody can feel tired. You've done everything you need to do. Right? But understanding these concepts that I'm sharing with you, is that Omaset? Omaset is here. Right? Understanding this concept that I'm sharing with you will help to shift that perspective. And don't be in a hurry. Some of you are so much in a hurry. You want solution today, tomorrow. It has to happen. You will be exploited. Calm down. Biology is time. Biology is precision. You cannot force it. Anyway, forcing it is what medication do anyway. So after forcing it for all these years, have you gotten any results? Calm down. Understand functional medicine, right? But I said all that to say that normal results does not always mean that there is no problem. It just means that you've not tested enough, right? But understand, more importantly, that fertility is not about an isolated number. This hormone is within range. That hormone is within, it's beyond that. It's about timing, it's about coordination, right? It's about interaction of hormones. Hormones are part of the larger system, not just one thing, right? So in fertility, success is defined not only by numbers, it's defined by precision. But even when everything looks normal, right, the smallest shifts can actually change the overall outcome.